Hello, hello, hello. We are live, and I am about to invite our guests for our Cyber Cipher session today on vaccine equity. So, give me a second. I'm going to get my peoples, and we're going to go ahead and get started. In the meantime, get in the chat and let me know how you feeling, how you living, how you doing. I'm Alicia Garza, principal at Black to the Future Action Fund. Here we go. We're going to bring some cool peeps in here. Hello. Okay. And yes. And it looks like we are getting our peoples in just a hot second. Really appreciate you. Yes. What's up?
Hey.
Hello. How are you?
Good. How are you?
I'm good, and I'm so excited to see you. Hello.
Hi.
Hi. Okay, so let's get started, y'all, because everybody knows we have a lot to talk about in terms of this vaccine question. And I wanted to first welcome people to the Cyber Cipher and let you know that we are joined today by two of my faves, one of whom is a badass doctor and also my cousin. Oh, oh, oh. Please welcome Dr. I said, Dr. Imani McElroy. Thank you for joining us, Imani.
Thank you.
I also want to welcome Santra from the Miami Workers Center, and you are the incoming CEO, is that correct?
Yeah, we go by executive director, but it's almost a year now, actually. So
you know what?
I survived.
I support you. I appreciate you, and welcome. Miami Worker Center is one of my favorite organizations. So y'all ready to get it in?
Let's do this.
All right, so let's talk, y'all. I mean, look, here's what's really real. We are still in a panoramic, a panini, otherwise known as a pandemic. And for the better part of a year now, more than 500,000 people have died because there has not been enough adequate information and access to resiliency in the face of these kinds of crises. Pandemics are things that happen relatively normally, right? I mean, this is how we have the flu vaccine. This is how we have the smallpox vaccine, right? There's some pathogens that get introduced. Imani, you'll tell me if I'm using the right language here, but y'all know what I'm talking about. Stuff gets introduced and it starts acting crazy. And then we got to figure out what we gonna do about it, right?
Exactly.
100 years ago, more than 100 years ago, right? We had a flu pandemic, and that is how we ended up with the flu shot, which I religiously get every single year because my mama told me to. She was like, you doing too much, okay? You out here playing, and you could just get a shot and be done with it. And I know you like to work, and you like to work too much, and then you be mad because you be sick for 2 weeks. Break the cycle, right?
I know that.
Exactly. So I wanted to start off with that context because I think for a lot of us, right, we're like, how did we get here? And the truth of the matter is, it's not really about the pathogen. It's about the terrible response to dealing with the pathogen. And on top of that, all the misinformation and disinformation that came from and because of that terrible response. So first, I want to kick it over to both of you to kind of talk us through that. How did we get here where people are like, I'm being microchipped and, you know, all the things that people be talking about in terms of these vaccines, honey? Let's start with you, Imani.
Yeah, so I think the first and foremost, like you said, the thing that really tripped us up was our lack of response. We had safeguards in place before a certain administration took over, and those were pulled back. We were not prepared. We were basically, you know, heads in the sand, acting like ostriches, as if this wasn't going to spread. Like, we have a global world, so of course, this was going to spread to the other countries. And then once it got here, you know, we pretended it wasn't going to do anything. We told people not to wear masks. We said wear masks. We politicized it and put our communities first. We were very, very big on this rugged individualism. And we prioritized our own needs instead of putting the community first. And so I think that was our first and foremost, our downfall. I think the other thing to understand is that, you know, there's a lot of things talking about people saying that, you know, COVID is a new virus, and it is technically, you know, the SARS-CoV-2 virus, although we do have SARS viruses, this was a new strain that we weren't aware of. And so that's why there was a lot of information in the beginning that was so mixed and confused. We had to figure out how it was transmitted, when it was transmitted. And so there's a lot of information we had to work with. But I think having, you know, the faith in the scientific community undermined by the administration and not listening really set us back. And so now we've ended up with over 500,000 deaths that were very unnecessary.
And Santra, how does this impact the communities that you're working with in Miami? I mean, obviously what we know is that Black and Latinx and Indigenous people in particular were disproportionately impacted by the failed response to this virus. And so much of that had to do with the fact that our communities were being failed before the panini. And then when the panini came around, it was just worse than it was before. So talk to us a little bit about that.
Right. I think for us in Florida, it's that it felt like and seemed like as soon as it got really clear that our communities were the most impacted, that all of a sudden there wasn't a focus on let's figure this out. And so I think that's real, and we definitely want to name that. In Florida, specifically Miami-Dade County, the 10 hardest hit zip codes are African American. We also know that Florida is like, it's a free for all in Florida. They didn't mandate masks, schools open back up, restaurants and bars never really fully closed. And so Florida in particular put profits over people and continue to put the lives of Floridians at risk. And when you think about immigrant folks who have real fear, this is not made up fear. They're fearful of government. Government has wronged them many times before. To hear these back and forth around, you can do this, you can't do this, it becoming politicized really threw us for a loop. And I think we're still trying to recover from that.
That's right. I mean, it was back and forth. Wear a mask, don't wear a mask. You can wear a mask if you want to. And in a lot of these states out here, honey, they'd be like, wear a mask if you feel compelled to, okay? And those happen to be states where there are deep and high concentrations of Black communities and Latinx communities and Black immigrant communities. So I really want to dive into that quickly, Santra. Like, how were Black immigrant communities being impacted here? Because I think we often forget in this conversation, right, that there are communities who are already deeply distrustful of government because government's been going after them. And in particular, as it relates to immigration status, you know, what does it look like when we're trying to reach out to people about their safety and using the government to do that, right? But people are afraid of what is happening with government because government's been attacking immigrants. How do all those things intertwine?
It looks like what we are seeing, that I'm from Florida, but my family is from Haiti. Florida has one of the largest Haitian populations in the United States of America. And yet when when the information was coming out, resources being made available, a lot of it was not translated. There was no interpretation. It's after the fact on websites that people can't get to. And folks forget that unless you're working an office job, these internet streets are not necessarily your day-to-day, and it can be quite challenging trying to navigate. We also know that, you know, folks who are Caribbean, Black folks, don't typically trust Western medicine. That's like, right. We love our teas. And so there had to be some work to me from the beginning of the pandemic to know that these communities would be resistant, rightfully so, to the information that's being shared. So we saw, and I say specifically for Haitian communities, and I'm for sure Latinx communities, lots of death. Big names, people who are prominent in our communities have died. There was recently a study around overwhelmingly children have lost at least one parent during this pandemic in Florida. And so we're seeing death. We've also seen deportations continue. And so it's a lot that immigrant communities are experiencing, how to navigate school systems and take your kids to school if you don't speak the language, if you don't know how to access technology like you need to. And so the amount of children who are missing out of the school systems from last school year to this school year is enormous, and they're calling them missing children who haven't been able to navigate schools. But if you're an essential worker, you're working and you have to take care of your children, you're also at risk for eviction. You also don't speak the language. I mean, my God, that is so much to deal with at the same time. And for us at Miami Worker Center, we're also thinking about folks' mental health. We've been through this for a year now, and we're starting to see it really bubble up, that people are stressed, people are short, their tempers, and it's really a manifestation of, you know, the body keeps count. The body really takes toll of what it's experiencing. That's and so, I mean, if you live in the intersection of being Black, being a Black immigrant, we know that they've been hit worse. And I want to pause before we talk about the numbers in Florida about, you know, Black folks are not being vaccinated in Florida, and the numbers are not looking good in Miami-Dade County at all.
Well, we're about to jump right into that, honey, because look, now that vaccines are starting to flow like a mighty stream, we need to be paying attention to who's it flowing for and where is the dam still backed up. And as it relates to our communities, there are a lot of different concerns that we have here. Number one, of course, you know, our communities have a deep and painful experience with medical racism, where our communities were experimented on, our communities were tested on in ways that were, you know, to quote unquote benefit science, right? But certainly created a legacy of generational trauma. But we just did a poll with HIT Strategies, asking our communities all over the country about how they feel about the vaccine, whether or not they're going to be taking the vaccine, and what it would take to get them to take the vaccine. And what we heard was that it wasn't actually about medical racism. We're clear about that. We know that that's what be happening, but that's not actually why our communities aren't taking it. In a lot of ways, what we heard from this poll is that our communities are not interested in the vaccine, about half and half, right? Half of people, mostly older folks, being like, I'm with it. A lot of younger folks being like, I'm not sure I'm going to go ahead and do that. And the number one reason, they don't know what the vaccine does. They don't have information about what the vaccine does. So they're saying basically, I don't know what impact it's going to have on me. I understand that there's a vaccine out here for this, but what does it do? Are you giving me COVID, or is there some other kind of thing that's happening? So Imani, I want to turn to you to really kind of dive into this. Number one, can you tell us what the vaccine actually does? Like, can you just break that down in like layperson's terms? And then secondly, I want to ask you, you know, how do we get over this hurdle? Why is it that our communities aren't receiving this kind of information the way that we should be?
Yeah, I think just to start, like, what do the vaccines do? So you have the two mRNA vaccines. That's the Moderna and the Pfizer. Those are the ones that came out first. And so those are a little bit different from our traditional vaccines in that when you think of the flu shot, you think of a weakened virus, and that's how it brings the genetic information that that helps your body fight the immune response. What we did with this one, which is the mRNA, is we basically have a special protein that's on the outside surface of the virus called a spike protein. And we have the code of genetic material that creates that spike protein. And so we inject it into the body, and what happens is the cells take it up, they create that spike protein, and they create antibodies to it. And so that's how you build the immunity towards the virus. And so if you get exposed to it, your body has already seen it without having to get any of the massive other side effects that come with getting the actual virus.
Yes.
So
that was excellent. So it's not a microchip?
So there's anybody really worried about a microchip? The microchip is what we're using to communicate with each other right now. That's just as on January 6th, real fast. So then with the Johnson & Johnson and the AstraZeneca, those are actually other types of viruses that are very common in the public called adenoviruses. And those are inactivated, so they can't make you sick. And then part of the same thing, the spike protein, the genetic material is put in those, and then it's just like the flu shot. You get that, your body reacts to that, and the same process happens. So The two big differences is that the mRNA is it's one little thing. It's like a very small material, but that's why you need to freeze it. That's why it's expensive. That's why it's a 2-shot step. But it also is why it has such a good efficacy. And then the other two are, like I said, they have very good efficacy. The Johnson Johnson's at 85%, and then the AstraZeneca one's not yet released in America, but it's at just under 80%. And that's why they have a slightly different, I'm seeing highs in the chat. Slightly different efficacy rate. But the thing that all four of them have in common, which is the most important part, is they're highly efficacious in stopping severe disease, which results when you end up in the hospital and you end up dying. And so those ones, so even if you have a lower efficacy in the less severe disease, or a symptomatic disease, you might get a little bit sick, but it's unlikely you're going to die from the process. You're just going to be out of work for maybe a week, which for some people can be devastating as well. It's not, don't get me wrong, but the long-term hospitalizations, month at a time, wasting away in the hospital is what these vaccines prevent. And so that's the important part. And then as to why our communities aren't getting them and why this information is not out there. I think you touched on it a little bit. There's the very easy low-hanging fruit that the media has jumped on and everybody's jumping on and talking about vaccine hesitancy and Black people just don't trust medicine. One, like, we have every reason not to, not just because of historical reasons, but because of current reasons. There's reasons throughout medicine why we do not trust doctors. It was in the last decade, there were studies put out that people still think we don't feel pain in the same way. There's a reason doctors were ignored. So medicine has a lot to do on its own to address racism and biases. And I think there's this laziness because we're so eager to jump for the low hanging fruit. We don't take the time to explain. And that's really what it is we're not taking the time to explain it to our patients and taking that extra step. And we're also, what I'm seeing a lot of is doctors just aren't asking why. I think one of the biggest things I've seen, especially with Black medical doctors, is we're asking our patients why. And they're giving us very valid concerns and reasons, and we're taking the time to explain. And at the end of those conversations, they're like, well, I think I will get the vaccine now. So giving your patients a voice will honestly deal with most of this. And then I think from there, it's just, medicine is still run by corporations. And so the vaccines, you follow where the vaccines are going, they're going where the money is going. So you're going to the big cities, you're going to the wealthy neighborhoods, you're going to places that are going to have great access. The Black community, Latinx community, we're not a priority still for this country. I think that's a great disservice to us considering everything we contribute. And I think that's why we're not getting the vaccines, and that's why there's no effort to talk to us about it.
Yeah. Santra, are you seeing this play out in the Haitian community and in Black immigrant communities in Miami and in Black communities in Miami? Are you seeing a lack of information? Are you seeing a lack of initiative from our government in making sure, right, that people have access to the tools they need to be resilient in the face of this crisis? Tell us what you're seeing on the ground.
Absolutely. And I just want to name that originally, even with the testing sites, a lot of them were drive up. And there's a huge assumption that people have cars, right? And so you're talking about poor people, whether or not they have access to vaccination, and the same thing around testing that we saw, that you have to have a car, specifically around the time frame that vaccination and testing was occurring, whether or not people can access those places, whether or not they're accessible on public transportation, and the languages that are spoken. For me, I think for the Haitian members, we also have historically African-American deep roots in Miami, been here for generations, also Latinx groups. Folks like to talk to their people, right? And so they want to hear information, not on the internet. They want to talk to people, very much an oral community when I speak to specifically immigrant people. And I think that there's a need for our government to double down and be truly culturally competent around how we message to people. It can't be a one size fits all. It really has to be tailored to specific communities. If you don't get the pastors on board in many communities, and they're not on board, And so there's work to do to make sure that pastors are on board. If you don't get these millennials on board for their baby boomer parents, you need to get the millennials, and I'm a millennial, right? You got to get us on board, because I've seen my friends convince their parents to get vaccinated. And if we're like, no, our parents like, no, I trust these kids, because especially immigrant parents, because these are the folks who translated documents for me. These are the ones who've helped me understand and navigate the system. So if they're like, no, it's a full stop for them. And so those are the things that have come up for us. Two more things around immigration. I forgot to mention this earlier. A lot of workers, as well as nannies, and many of them lost jobs, and they're still not working. And so the financial impact to COVID has been large. And then one more thing, my background is public health, so I wanted to come in on vaccination.
Oh, come on.
As a child, I felt like I was like one of the first groups to get the chickenpox vaccination. I never got the chickenpox. My sisters got it. And there's going to be a generation of children who never get the chickenpox, right? And so again, like, there's opportunities for us to present information in a way that is real to people. Chickenpox is really real to people. I don't know about polio, that was not my age group, but I know what chickenpox is, right? And many of us do. And so again, we need to make it real and tangible. And I think for our communities, we have to talk about trusted sources, right? In the same way that we learn in our fancy schools. Some of these sources through WhatsApp, through this stuff, it's just like, our teachers would have never let us cite this stuff. And so I think we need to talk to our communities around, who can you trust information to be provided from? And again, it's like, trusted messengers have to get it. I'll pause, but one more thing. Jingles, Haitians love jingles. Haitians love a jingle. They love things to music. And so we have to get creative in this stuff as well. It got to be fun. It got to be sexy. It got to be cool. And I think the government is failing us in reaching our communities. It's boring. It's sad. It's doom and gloom. And that's just not going to move us in the way that we need to.
Listen, I'm taking that with me. Haitians love a jingle. I'm taking that with me. So I want to transition really quick. And also, for those of you who are watching, please put your questions in the chat or in the Q&A box. If you see me swatting around, it's because there's a little fly that just wants to be around me right now. Okay? Because we're talking about vaccines. But put your questions in the chat and we will answer those questions. This is your opportunity to get the information that you need, so please take it up. I want to switch over to talk a little bit about some work that we did earlier this past year when the pandemic kind of exploded. And at the Black to the Future Action Fund, we took this opportunity to design a COVID-19 plan for a relief and recovery for Black America. And really what we were looking at here is all of the different ways in which our communities were being impacted by COVID-19, which wasn't just healthcare impacts. Obviously, there were also housing impacts, impacts in terms of the economy, impacts in terms of democracy rights. And we are still updating that plan, trying to push the Biden-Harris administration to continue to get stronger in relationship to vaccine equity, which is 100% a racial justice issue. It is not enough to just say that Black communities and Indigenous communities and immigrant communities and Latinx communities are being disproportionately impacted. We have to talk about the fact that that disproportionate impact has everything to do with the attacks on our communities from corporation, from corporate greed, and frankly, from government neglect. And so the way to address it, right, is to put your money where your mouth is, child. Put money and resources into our communities so that we can have more doses of the vaccine, so that we can have information campaigns that are tailored specifically to us, from us, by us. And actually, like you said, Santra, it doesn't really move people to hear Barack Obama talking about how he got the vaccine, because people think you got a special vaccine. We need to hear the doctors in our communities, the preachers in our communities, our neighbors, our clinic workers, right? We need to see people that we know talking with us about this. So I want to ask y'all, big picture thinking here. When you're looking at this rollout in terms of the vaccine, and you're looking at how it's rolling out in our communities, what is one thing that you would improve right now to make sure that that rollout is racially just and racially equitable? Santra, I'm going to start with you because you was out here talking about Haitians love a jingle, child. So I know you got ideas. What you got?
I feel that because if we are talking about liberation and we're talking about equity, we're talking about more resources. So it can't be, oh, we got one in the Black community. Actually, you might need 5.
That's right.
Right. That's what that looks like. And so I think that we are not seeing like overrepresentation of vaccination in the communities that we're working in. And I'm thinking if we're hit the hardest, why wouldn't we get the most resources? Like that just makes sense to me. So that's what I would do. I would double down in the communities that are hit the hardest and not necessarily just be like a northwest, south, east, have it covered. That's just not going to work for our communities.
Mm-hmm.
Imani,
how about you?
100% agree. I think that the biggest thing that I've been a proponent of is we need to look at the zip codes in the areas. We know which city those are. We know where the locations are. And we need to be pouring resources into those communities because these are the same communities. Not only they're heavy hit, like they're the essential workers. They're the people who can't socially distance. They can't take time off from work. So they are the people who need the most support. That should be our number one priority. I also think the other thing we need to do is truly make it easier to sign up for a vaccine. Like the biggest thing I heard from the entire rollout from me getting my vaccine was a disaster on the internet. Like kept crashing, and you know, I work at a hospital, but calling my mom every day when she was trying to get on the list and having to get on these lists, and like luckily she knows how to use a computer, she has steady internet. That's just that automatically takes out a whole section of the population who don't have the hours to put into this, for one, and two, the necessary resources. Like not everybody can go digital, so you need to really improve. You need to have people, you can have walk-up clinics, you have people have registration, everything you can do to just get get the numbers out there, mass vaccinations. And I think the other thing is this whole thing of like, you know, having a way to, some people don't have IDs, so you know, like taking that away and just making sure you have a way, like the vaccination card is a good way to keep track. But making it mandated to bring a government ID, and everybody has a government ID. And so it's just, and I think it's also, we need to extend it to immigrants. We need to extend it to undocumented workers, because these are the people that have held this community and held this country up. And so to completely ignore them and continue to let them fail it's not only just inhumane, it's going to continue to have horrible outcomes for people in this country.
And I would say, trust us. Like, if you would bring this to our community, and we would figure it out. Trust Black people to get it done in their community. A lot of the folks who are not working, put them to work around vaccination, equity in vaccination, and they will get it done. They'll get really creative. Remember the things you saw coming out of elections that turned people out? So many creative ideas came out of that. Let us, give us the resources and let these communities make it happen. I see Nina in the chat. She said a Meals on Wheels approach. No person left uncovered in our communities. Right. What we could do it.
Right? One of the things is, you know, there is this level of people keeping like, well, you need to do this. Let us handle it. Let us talk to let us vaccinate our people. Like they don't trust y'all for good reason. And we want to be a part of this, you know? Yeah, the homie just went in the chat, like online registration in New York has been a crapshoot. And, you know, it's ridiculous. It's absolutely ridiculous.
So I want to spend the last couple of minutes getting to some of the questions that people put in the Q&A box. So the first question here, what do you say to a millennial friend that says they don't need the vaccine?
I mean, I guess to me, I'd have to say is, why do they feel they don't need it? And I think the big thing, especially in the beginning, it's like young people can't get vaccine or can't get sick, or they don't get that sick. And I think there has to be some understanding that it's, no matter who you are, how old you are, you can get sick and it can be debilitating. There's, you know, these long-term COVID symptoms that people are having. It's impairing their ability to work. And so I think the best thing the argument that I've been using for, you know, my siblings has been, yes, it's a shot. You're not hugely into the idea of shots, but it's a couple days of arm pain, maybe a couple fevers, but long-term health versus if you get COVID, there's a good chance that you will be very sick for a long time and out of work and unable to provide for yourself and your family. And that's not a risk that you should be willing to take.
I'm hearing this question in the chat too. Sorry if I missed this part, but my father is a Black immigrant and doesn't trust the vaccine at all. What can we say? Santra, what you think?
I'm looking for, and hello, Marianne. I always look for opportunities that are like examples that are relevant to the culture, where to make it relevant. I often say, what is vaccines made of? Like, is there cultural relevance to that we can really speak their language? Because on some level, we do believe in healthcare. Has he taken vaccinations at all before? If he has, what has been his experience? Are there family members who have taken the vaccine already that they can definitely come in and have a conversation? To me, those are all the approaches that I would take. I talk to people about taking pills all the time. Look, what are pills made of? Y'all eat this stuff anyway. And so there's opportunities to bring that up. Imani, I don't know if you want to come in as well.
Yeah, I think it kind of goes back to the idea. So you have to get an understanding of what's making them hesitant, and seeing if you can find that connection and explaining it on their terms. And I think that kind of goes with the question I see penned is how, again, going back to the distrust of the Black community has for the medical community. And part of that is owning that. And like I said, just having conversations, finding out what is going on, trying to figure out what is exactly driving the hesitancy, and going from there. It's just taking the time to treat people like humans and having a real discussion.
All right, here's another question. Will we need a booster after a few months?
So that's basically something that they're looking at right now. You don't need boosters. Technically, that's for any of the 2-dose vaccines, that's a booster. You get your first shot and then you get your booster 3 to 4 weeks later. Will this be something in the future that may need a booster shot, or almost like a yearly flu shot? It's unclear, but it's quite possible. I think as we see how the different variants take hold and move forward, we'll have to play it by ear. But right now, there's no need for us to actively promote getting boosters.
All right, I want to thank y'all so much for joining us. This was absolutely incredible. I also want to make sure that you all know that we are pushing very, very hard to make sure that we move resources for our communities to be able to be resilient in the face of this crisis. So if you want to join us, go ahead and sign up with the Black Mandate. And you can do that at bit.ly/BBB mandate. I'm also going to ask the B2F team to put the text number in the chat so that people can also text mandate to that phone number. If people who are watching right now want to volunteer to text bank, please register at our volunteer sign up page, bit.ly/B2TFTEXTS. Thank you so much for being here with us, y'all. We deeply, deeply appreciate you. And if you have any questions at all, we'll be here for you. We'll be back with another Cyber Cipher very soon. Thank you, Dr. Imani McElroy. Thank you so, so much, Ms. Santra from the Miami Worker Center. We love y'all. See you soon.